We're joined now by Jill Furillo, who's the head of the New York State Nurses Association. You just spoke at our event outside to the crowd, and one thing that really struck me in your comments was this comment that what happened in Brooklyn was kind of like a catalyst for what was happening elsewhere. And then obviously hospitals in Brooklyn, the closing of certain hospitals in Brooklyn, and also like the reorganizing of hospitals in Brooklyn has been a huge issue in the borough. And you've been fighting to make sure that nurses aren't getting cut. You've been fighting to make sure that there's the proper levels of staffing there. Tell us how the fight in Brooklyn and the success you've had here has helped outside of the borough and throughout the rest of the state.
So we started a fight in Brooklyn a few years ago when there was just an epidemic of hospital closures, and nurses are patient advocates. We really had to take that on. I think there were 26 or 27 hospitals that had closed within a period of 10 years, and the trend was continuing. And so we had to take that on because number one, patients were losing health care in some of the most vulnerable communities. The communities that needed more health care were the ones that were losing hospitals, so it made no sense. People suffering from poverty-related diseases need to have that access to care, and they were losing that access. So we learned as a group of nurses how to work with other people, how to work with elected officials, how to work with community organizations, how to work with the churches, all the various people that represent patient populations, very diverse patient population. And through those coalitions, through building those coalitions, we were able to keep a couple hospitals open for a couple years longer than what they were going to close. February.
They were on the chopping block.
They were on the chopping block.
Bill de Blasio got arrested during the campaign outside a hospital that was about to close.
Yes, he did, and I was one of those people arrested. But again, we were fighting a battle that had been going. This was an issue, a trend that was going on for a long time. But we had to take that stand. By doing so, we built the coalitions, and we were able to keep that hospital going for a while. We were able to get the funding for Interfaith Hospital, which is in central Brooklyn, a vulnerable community, and that hospital is still going. We built a coalition with all the different organizations, the churches, elected officials, and we've been able to get the funding from the governor to keep that hospital going. That was a catalyst for us going into our negotiations, and we just settled our contracts with all the major hospitals, private hospitals. We had settled the city hospital contract the year before, HHC. This year we just settled, this week, most of our major contracts, and we had quite a victory with that settlement. We had no takeaways on the benefits, no takeaways on the pension. We got a very good wage increase, but the most important thing that we want, and it was the core issue for us, was we needed more nurses. We have to have more nurses in these hospitals and in the clinics and everywhere where healthcare is delivered. And so we won hundreds and hundreds of new positions as a result of that negotiation. Now, what that does is it's actually creating jobs. It's creating jobs for people that are looking for nursing jobs now. They'll be able to get those jobs. And for young people that are going into nursing now, that see nursing as a career, they have a hope that their future, that they'll have a future as a nurse, working not just in Brooklyn, but everywhere throughout New York City.
The growth that we see in Brooklyn, that everybody speaks about, the borough president spoke about it, the Chamber of Commerce here in the Brooklyn Navy Yard. When it comes to healthcare, to people who actually are on the front lines, the first line of defense for a person who is ill, how important is it that Brooklyn, is it keeping up with the development and the 2-point-something million people that are actually residing in Brooklyn? Do you feel satisfied that there's enough nurses? I know you want more nurses, but how is healthcare and the growth of that industry to be able to, take care of all these people that are in this growing borough?
I think it's a tremendous challenge. I think that we're not keeping up with this growth, and the issues. That's another issue that we faced in these negotiations. And like I said, we did the best we could in terms of trying to create these positions, but our job is not done. And with this growth, people are going to need health care. Health care is being reorganized. They're now moving. trying to move to the outpatient, to have more of the healthcare delivered in the outpatient and in home. And for people that are suffering from, high-risk diseases, that is an option to have primary care, but at the same time, they're going to need acute
What
care
would
as
be
well.
the perfect number to feel that you would feel satisfied that Brooklyn is being served by nurses in a proper way to be able to match its growth right now?
You mean in terms of the number of
Numbers,
hospitals
yeah.
and
How many
clinics?
more do you need?
Well, I would say we would need, a few. In Brooklyn, we would probably need a few thousand more.
A few thousand
Yeah,
more.
when you go around, see, registered nurses are not just in hospitals; they're in clinics. There's also the family nurse partnership or nurse-family partnership, where you have public health nurses who go out into the community and work with people like new mothers, have their first child. They do work with them, and they work with them over a period of time. So if you look at what you get, what society gets from having the nurses in the community, working in the community, working in the clinics, working in the outpatient, working in the acute care, working in the nursing homes, working in the home care, we need many more.
I want to ask you like a larger scope question, because we're hearing we're restructuring healthcare with obviously the passage of Obamacare. Everyone talks about costs and cutting costs, and whenever you talk about a large system like this and cutting the cost of it, it seems like the simplest thing to do is to kind of walk into the situation and cut across the board. And I think when you do something like that, obviously that means like, oh, you're going to cut nurses, but to me it seems like there's a difficult approach there to do that, because the health system is complicated. So if you're cutting the staffing levels, like it's going to be longer wait times, it's going to be less care. How do you, from your position as an advocate for nurses, explain to people that like this is something that shouldn't be cut, and make that case when everyone's like, well, we got to cut costs, and the simplest way is just to cut across the board?
It's just having a vision for prevention. That the best way to cut the costs is to provide on the front end, so that you're not having to spend the money on the back end, and having the appropriate number of nurses, and nurses who have the right training in this environment, in this changing environment, to be able to interact with patients and their families.
Yeah.
That is the way that you're going to cut the costs. And there are studies out there, many studies that show having the right number of nurses with the appropriate training, does actually cut costs and saves money to the system, because it's based upon prevention. It's based upon people being healthy as opposed to being ill. Now, when people are ill, you also need to have the nurses there. In the next few years, we're going to be facing a tremendous nursing shortage. Baby boomers have hung on.
Yep.
They've hung on because of the financial crisis from 2008. They couldn't retire. But now they're going to be retiring. And we are not graduating enough nurses now to be able to fill those slots. So we have to keep our eyes on that as well.
Well, we'll be following that very closely throughout the years. I'm sure you guys will have many more contract battles, and you will be fighting with the state and the city for the next couple of years to make sure that the funding stays there. Jill Furillo from the New York Nurses Association, thank you so much for joining us.
Thank you.
Thank you.
Thank you.